Are you ready, Kathy? Should we do something?
Let's do it.
All right, great. Good afternoon, everyone. Again, this is Sheree Spoke with Better Health Together, and this is Change Management Training. We're excited to have Cathy Kaufmann with us from Kaufmann Associates. She's worked with Better Health Together for several years, really instrumental in helping us design Medicaid transformation efforts and initiatives with all of you, and so a number of you have worked with her, and we're happy and thrilled to have her with us today. This particular training we have done once before, so you are more than welcome to stay with us if you've gone through it once before, but if you have, it will be somewhat of a repeat. I also want to note that this is part one of the series. So today we're going to be going over some particular models of change management, and Cathy has some great lessons learned from her experience in Oregon with Medicaid transformation. So she will be sharing those. And then next Thursday, August the 6th, we're going to be focused on strategies for working across organizations or across sectors. And through our work with a number of you, there's a lot of organizations that are working not only across sectors, but across organizations. Although that is wonderful work, it's a little bit complex at times, and so we will have a training to work through those and address that August the 6th. And then the following Thursday, August the 13th, we're going to be going over the importance of quality assurance and quality QI in change management initiatives. So that's also going to be an important component as you go through change management, looking at your QI and QA and how those align with your efforts. So with that, would love to hand it over to Cathy.
Hi, everybody. Thanks for joining on your lunch hour. So I'll tell you all a little bit about myself in just a second, but so you know, this presentation is going to be an overview of change management theories, different schools of thought around change management, and then talk a little bit about some lessons learned, recipes for success, what to do, what not to do. So there'll be about 30 minutes of slides, and that should leave us plenty of time at the end for Q&A or discussion. So with that, I will dive right into it. And also, so you know, I am joined by my colleague, Ricky, who should just sit on the couch quietly, but potentially will bark if the mailman shows up. So excuse me ahead of time if that happens. I will get him out of here.
He's
usually pretty good.
Facilitator, love him.
So Cherise mentioned I've been working with BHT as well as other ACHs for the last few years, have loved working with the BHT region. You guys are really coming together and doing some great work. Also do work with Medicaid agencies in other states, Medicaid managed care plans, and other organizations that are working on these issues. I have a background of doing work here in the Medicaid agency in Oregon, the Oregon Health Authority. I led our Healthy Kids program, which sought to increase coverage for over 100,000 Oregon kids, and was the founding director for the Oregon Transformation Center, which helped to spread innovation and provide technical assistance and systems of learning for Oregon's coordinated care organizations, Oregon's version of MCOs. And also have a lot of background in policy advocacy, both at the state and the national level, all around healthcare and programs for kids and families. So our agenda for today, we're going to talk about what change management is, what we mean when we say change management. We're going to look at 5 different models of change management, really the most popular models. Then we'll talk a little bit about cross-sector change management and what's important to know around those change initiatives. As Cherise mentioned, next Thursday, August 6th, we will do another session like this, and that one will be a deeper dive on change across sectors and across organizations. And then we'll talk about why change efforts fail, the sad truth is most do, and the importance of leadership for change before we get into the Q&A. So first, what is change management? So there is a whole school of thinking around change management developed because change is hard. In fact, so hard that most change efforts fail. Studies show that as many as like 2/3 of change initiatives that are started don't successfully finish. Change management is a systematic approach to helping people and organizations successfully implement change. Sounds like a pretty obvious and basic definition, but what's important to know that change management is not project management. They are two very different things. Project management is more of the technical side and the to-do list of moving from how you currently do work to how you want to do work. Change management focuses way more on the human factor, on the people side of change, because change is not as simple as currently we use system X. Now tomorrow we're going to start using system Y. There's a whole lot of work around just people and their resistance to change and what motivates people to change and what makes change stick that's involved in successful efforts. So a lot of change management models, most of them assume that you already know what change you want, and it's just a matter of how you're going to go about getting there. Some of these models are based on a top-down, so more of a leadership-driven approach to managing change, while others emphasize a bottom-up, a people-driven approach a little bit more. There are models that focus more on how to identify what changes are needed. The fact of the matter is, and you'll see as we go through these models, there's a lot of overlap between them. And sometimes it just comes down to using different terminology or prioritizing one component over another. So the caveat from me is it kind of doesn't, any of these models are great. It really doesn't matter which one you use whatever one speaks to you or you think will speak to the people with whom you need to work to implement your change, and there's a lot of similarity across them. So here are the models we're going to talk about today. We're going to talk about the ADKAR at CAR model. We're going to talk about the Kotter's 8-step change model, Lewin's change management model, the McKinsey 7S model, and then the science of improvement, the PDSA model. And for those of you who are coming from a healthcare perspective, you're probably already really familiar with the science of improvement, the PDSA cycles. So starting with the ADKAR model, CAR model focuses on 5 concrete outcomes that people need to achieve for change to last. So the A is awareness of the need for change. D, the desire to support change. K, the knowledge of how to actually change. A, demonstrable ability to, or your ability to demonstrate change. And then R, reinforcement to make sure that change sticks over time. So in a little more detail, the first 3 phases are what are termed the enablement zone. You're really getting people ready and willing to change. And the last 2 are really about the engagement zone once you're in the actual work of implementing and reinforcing change. So in the awareness phase, and these phases aren't always nice and neat, one stops and the other begins. There can be a little bit of overlap. And I would argue that you want to make sure you're continually building and reinforcing awareness and desire throughout your process. But in the awareness phase, you're communicating the desired change. You're talking about the reasoning behind the change, including acknowledging any pain points, what's going to be hard, or what's already hard and part of the reason for change. You're also going to talk about potential return on investment for the change. And you're going to give people an opportunity to ask questions and make suggestions. So in the building awareness phase, communication is key. You want to be open to people's worries or concerns about the change. You don't want to quash those conversations. You want to bring them to the surface, because it's really the only way to be able to mitigate concerns and not have people sort of grumbling and not buying in all along the way. Once you've established at least sort of a baseline of awareness, then really the next step is moving into the building desire for change phase. You want to gauge people's reactions to change. You want to identify some key champions. So it's not just, for example, the leader at the top of the organization talking about change, but really identifying managers, frontline workers, anybody in the organization who can serve as a key messenger for all of the different audiences that need to be part of the change. Again, if people are resistant or indifferent, don't ignore that. Address concerns, demonstrate how the change could benefit them personally. It's not just an abstract theory of change that you want to implement. Really, win over hearts and minds. Make the case for, don't ignore your internal politics or your community politics. What needs to change? Why does it need to change? And what are the key messages that will help convince you that the change is going to be worth the effort I'm asking you to put into it? Then move into knowledge. Once you got enough awareness and desire for change, people need the skills and the tools to be able to change. So depending on what your change is, this will involve training or coaching around how to do work differently, addressing any skill gaps so folks are able to implement changes, offer resources like process flow charts or tools that explain how things need to be done differently. Make change as easy as possible. Don't make people fight for knowledge to understand what they should be doing differently. Make sure that you deliver it to them in a way that is easy to understand and really will help them do their work. The next phase then, as we move into the engagement zone, change is really underway. It's good to schedule practice runs before a change is fully implemented, test things out so that if there are changes in a process that need to be made, you can find that out with a pilot as opposed to a full-blown implementation that struggles in the early phase. It's important to monitor performance in as close to real time as possible so that you can follow how the change is doing, how it's being implemented, and give continuous constructive feedback. It's also really important to set reasonable goals and metrics at the start. So you might have a vision for a change you want to implement, and you're pretty sure in 5 years it's going to lead to a savings of $10 million, but that's not a helpful metric in the early stages of a change process. You need some short-term goals so that folks can feel like we're hitting some early markers out of the gate, and that helps keep people stay engaged and feel like progress is being made. And you need to adjust your processes as necessary. There is no perfect system, no matter how ideal it is in theory. Once you move to implementation, things always arise that no one anticipated, and that's okay. Just be prepared for it and have a process to allow you to be flexible and make changes quickly and rapidly as you need to, so that you don't lose that momentum and desire. And then the last phase is reinforcement. And again, this is a recognition that change is really comes down to human nature. It's less about the system and it's more about the people who operate a system. And so change management doesn't end once a change is fully implemented. It's important to monitor change over time, make sure it's getting you the outcomes that you want it to get. Use positive feedback, rewards, recognition. You really need to maintain awareness and desire all along the way. So the next model is the Cotter 8-step model, and you'll see a lot of overlap with the last model. So the Cotter model breaks change down into 8 steps. Step 1 is developing a sense of urgency. A lot of parallels with the awareness and desire phases we saw in the last model. Have open and honest dialogue. Don't skip this step. Don't move too quickly through it. Communication is probably the most important component of any change management process. Step 2, build a coalition of change leaders. As in the last model, where the step involves identifying some key messengers, some champions for change, the Cotter model calls for that too. Make sure you've got a good mix of people who will be good messengers for an array of audiences. Make sure you have their buy-in and their real emotional commitment. You need champions to be true believers, because that's the only way that they'll be effective at convincing other people and building their awareness and desire for change. It's important to have a vision for change that includes an elevator pitch. Those of you who work in nonprofit have heard the terms elevator pitch more time than you care to. But it is really important to have a short, succinct, compelling way to talk about what change it is that needs to be implemented and why and what it will get. Communicating the vision frequently and passionately is critical. Again, continue to address people's concerns and anxieties openly and honestly. It is not effective. It might feel like the most important thing is to get your message out about how positive a change is going to be. And when somebody in the audience or in a meeting brings up all of the worries or concerns or problems that they see with what you're proposing, it can, all of us, I think, have the instinct to want to sort of not spend our time focusing on what might feel like nitpicking, but it's a more effective communication tool to be really open about whatever concerns or worries folks bring to you, whether it be in a team meeting in your organization or a big collaborative meeting across the region, because that's the only way that you can really address those things head on. One, it might be genuinely good information and something that you haven't considered before, and truly listening will strengthen the model. And two, even if the concerns feel unfounded, your job is as much winning over hearts and minds as it is implementing a new way of doing things. And the only way people will be convinced to listen to you is if you genuinely listen to them and hear what they have to say. So step 5 starts to move into the implementation phase. And another key step here is removing obstacles and empowering action. Having worked in a large state agency with thousands and thousands of employees, I have certainly experienced all kinds of bureaucratic obstacles that don't always make sense and may just be there because they've always been there. It's really important, if you're asking folks to change, that leaders play a key role in getting rid of obstacles and clearing barriers. It not only makes it possible for people to do the work that you're asking them to do, for implement the changes that you want to see, but it also demonstrates that you see yourself as a team member too, and you have their back, and you will work to clear the way so that they can do the important work. Make sure that addressing processes or structures that are getting in the way exist, and that you can encourage, support, and reward any change around that. Have processes so that problems can be elevated and not end up being bigger roadblocks than they need to be. As I mentioned with the last model, really important to get quick wins. You've got to change, you probably have big picture goals for it, and those matter, and those are part of the vision. But if you don't give people quick wins all along the way, they're going to lose steam. Change is hard. We all know what's needed to fix healthcare. We all know what's needed to fix social service delivery. The problem is not a lack of knowledge of what needs to happen. The problem is how hard it can be for all of the systems and the funding streams involved to change, and especially to change quickly. So quick wins really matter. You can leverage those smaller wins to drive change. Leveraging these wins, celebrating them, helping everyone understand how they point to a bigger goal can help build a culture of continuous improvement. You can celebrate and also learn from the interim successes as well as the failures. They are as informative as the wins. And then lastly, as with the last model, there needs to be attention paid to reinforcement. Embed change in the organizational culture. So to make any change stick, it's really got to become part of the core of your organization, and you need to reinforce it and continue to pay attention to it, and make sure that organizationally it's seen as valuable and important. So just another visual for Kotter's 8 steps. It's broken down into 3 phases instead of 2 phases. I really like this way of thinking about it. I think it's simple, straightforward, logical. Phase 1 is create your climate for change. That's about creating your urgency, getting your messages out there, getting your vision out there, developing a strategy, and starting to build your coalition of change champions. Phase 2 is really about engaging and enabling the whole organization. You've got a plan, you've got your vision, you've got the team of change champions who are going to help you do this. It's time to move into spreading this throughout the organization. It's communicating the vision, empowering action of everybody in the organization to implement the change, and getting and celebrating those quick wins. And then last phase is implementing and sustaining, reinforcing the change, leveraging your wins for more change, and making sure that thinking about change and valuing change is embedded in the organizational color. It's not, okay, that change project is done, we did it, now let's go back to things as usual. So then another model, simpler, is Lewin's change management model. And this is really thinking about change in 3 steps. Step 1 is it's using a metaphor of an ice cube. Step 1 is you need to unfreeze current process perceptions when preparing for upcoming changes. Step 2 is, okay, you've unfrozen, you've sort of, said, let's erase everything we were doing before and think about how to do this differently. And then it's time to implement the change. Once your organization has temporarily melted. Again, change requires clear and constant communication, both during and after it's been implemented. And then lastly, the refreeze phase, which is like the reinforcement phases that we've seen in the first 2 models. So assuming that there's an accurate feedback loop and lots of ongoing communication during the change step, the refreeze phase can lock the new process or the new system in place. A little more detail about these 3 phases. You will see that celebrating success, communication are mentioned repeatedly in every model that we're looking at, and that's for a good reason. They are probably the 2 most important ingredients to successfully managing change. The McKinsey 7S framework. So McKinsey is, many of you probably heard of McKinsey. They're a super huge global consulting firm. They do work for business, government, all kinds of entities. And they've developed this, what they call their 7S framework to looking at an organization. And this is one of those models where it's helpful to think about change. It's also maybe more helpful as a way to think about what changes are needed, not so much implementing a change management program. So the McKinsey 7S framework breaks an organization down into 7 interconnected areas. The organization's strategy, the structure, what's the staffing model, what systems are in place, the funding streams, 3 is what systems you're using. And then on this second column, 4, 5, and 6, we move more into the human side. So 4, what are the shared organizational values? What are the skills? Who are the staff? What is the style of the organization? And in their view, all of these things matter equally. All 7 things are important. But number 4, those shared values are really what's at the center of both the harder and the softer side of the 7 S's. And that's illustrated here by this framework. Sorry, I have to keep letting the dog in and out. This is one of the joys of COVID working from home. So you can see shared values is at the center of the model, and it connects the hard S's, strategy, structure, and systems, with the soft S's of skills, staff, and style. Oops. And the idea with the McKinsey framework is simply that if you map your organization according to these 7 S's and make explicit some of these things that we frequently don't make explicit. We probably know most organizations have a written strategy, structures are clear, systems are clear. Sometimes shared values are clear, sometimes they're not. And the skills, staff, and style might just be assumed but never made explicit. And in this framework, it's considered really helpful for an organization to map out all 7 S's. And by mapping out the 7 S's and making sure that the shared values are reflected both above and below the line there, you'll be able to identify where change is needed. And then lastly, the science of improvement. This is a really successful model for change that's been implemented by hundreds of healthcare organizations in many countries around the world to improve healthcare processes and outcomes. The science of improvement is not necessarily a change management model. It's really a way to accelerate improvement. So for example, you might say, I'm going to think about my change. I like that Cotter 8-step model. It's pretty simple and straightforward. I'm going to think about my change using that model, but I might also use the science of improvement approach to measure my quick wins and measure my continual improvement. So the model has 2 parts. There are 3 fundamental questions. We're going to look at those in just a second. You can start with any question in any order. It doesn't have to go in order of 1, 2, 3. And then there is what's called a Plan, Do, Study, Act, PDSA cycle, to test the changes in real work settings. So starting with the idea of a pilot or a small test of a change, seeing how well it works, and then spreading it out. The PDSA cycle helps you know whether or not the test that you've tried is an improvement or not. So the steps in a science of improvement model: 1, you got to form a team. There needs to be a team that includes members who are familiar with all the different parts of a process, managers, administrators, as well as frontline workers. So, for example, if the change you want to implement is, say, your intake process for clients, you wouldn't have a manager just sit by herself or himself in a room and come up with a change process. You'd have the manager, you'd have a couple different frontline workers, you'd have maybe the person who sits at the front desk and plays a role in the process, you'd have your IT person who manages the systems. You'd want to make sure you'd have a reflection of the full team that has any kind of a finger in the process that you want to change. You want both on the ground knowledge and you want leadership knowledge. So once you form this team, then you need to set your aims. What are you trying to accomplish? And for those of you who have been working with BHT through a primary care behavioral health contract, you've all been asked to develop your aims and milestones, and very much in line with a science of improvement process. So set your aims. What are you trying to accomplish? Your aim needs to be time specific, and it needs to be measurable. So your aim can't be, I want to make things better for all of our clients. Your aim needs to be, I want to increase our rate, or the amount of time, or reduce the amount of time it takes to do an intake by 20 minutes. That's a measurable aim. You should define your specific population of patients or the other system that will be affected. So it has to be clear, simple, straightforward, and something that you will be able to know at the end whether or not you achieved it. Then you'll establish your measures. How will you know the change is an improvement? What will the change, what outcome are you expecting to see? Teams use quantitative measures to determine if a specific change actually leads to an improvement. This is your way of stepping back, being a scientist, seeing whether or not the change you've implemented is actually better. Then you select your changes. What change are you going to make that'll result in the improvement? The ideas can come from people who work in the system, experience of others who've improved a system somewhere else. And then you test those changes in your small scale using that PDSA cycle. You've planned what changes you want, what your aims are, you do it, you study it, you take the information from your study, and then you act. You're continually adapting. You're assuming that when you test something, it's not going to be perfect the first time, and there will be lessons learned that can help you strengthen the model. After you test on a small scale multiple times, you can refine your change, and then you can implement on a broader scale. So for an entire population instead of just a small pilot, or an entire unit. And then you can continue to spread your changes from there. So the 3 key questions in the science of improvement model, and again, you can tackle these questions in any order. It doesn't have to be in order of 1, 2, or 3, but they are, what are we trying to accomplish? How will we know that a change is actually an improvement? And then what changes can we make that will result in an improvement? And you can see in the plan, do, study, act, it goes clockwise, all of the steps. Forming your team, developing your plan, carrying out your plan, testing it, and then strengthening the model based on what you've learned in your tests. So I want to shift gears a little bit and talk about cross-sector change management. I think all of what we heard in the other models for change management and lessons from the McKinsey framework or the IHI science of improvement approach, I think all of those things apply. None of them are wrong when it comes to implementing change across sectors. But obviously it's a little more complicated when you want to develop a change that's not just for a bunch of people in your organization, but for a bunch of people in multiple organizations, maybe people in different sectors where you don't all speak the same language or necessarily even want the same things. So the complexity increases. So cross-sector collaborations need to do the same work around building awareness and desire as in the other models, but I think they have to spend more time on those steps. Those things are critical for all change. They're especially critical for cross-sector change, and many cross-sector partnerships fall apart and dissolve if the first 2 steps aren't given enough time and attention. Cross-sector collaborations need to make sure they've developed a shared understanding of prior initiatives or efforts. Has folks in the community come together before to address the same issue? If they did, what happened? What worked? What didn't? What are the lessons learned? So you don't have people continually repeating the same thing over and over without learning from history. Cross-sector collaborations also need to develop effective governance structures and mechanisms. This is really about creating a trusted partnership. And I think for many of us, especially in these, this line of work, we all have these jobs because we want to make the world better in some way, right? And so when we get together with folks from organizations with the same kind of values, I think there's an inclination to just trust, we're all social workers, we're all providers, we're, you know, we trust each other, we're going to be able to work well together. But it really, but that rarely works. And what makes cross-sector collaboration stronger is if governance structures and mechanisms are determined on day one. So, for example, who are the decision makers for an organization participating in a cross-sector collaboration? Is the decision maker part of the collaboration, or is the person who's participating in the collaboration got to go back and talk to the decision maker? Either way can work, but it's important to get clarity out, you know, at the onset around that. Who will get to make decisions for a collaboration? How will decisions be made? Does it need to be consensus? Is it going to be majority? The more time a cross-sector collaboration anticipates not agreeing on everything, the stronger it will be. Governance really matters when there is a point of contention or people have you know, different point of views about something, and when you can turn and say, well, let's go back and look at what we agreed to for our decision-making process, or let's go back and look at our ground rules, or let's go back and look at what we said was the scope of this collaborative. That can really help resolve the vast majority of conflicts that come up in cross-sector collaborations. I have experienced that personally. I am a big believer in, on day one of any group coming together to do anything, to put together a charter, make clear why you're there, make clear how you're going to make decisions, make clear what your ground rules for working together are going to be. And all of that really helps to build trust. It's also important to have clarity around shared responsibility and accountability, ideally with ways to measure things, ways of knowing, did X happen or did it not happen, or did X get us the outcome we expected or did it not? Also part of building trust, but you need a cross-sector collaboration to have a group of folks who are committed to doing the work, not just attending meetings. And so being clear about shared responsibility and accountability helps make that happen. And as with all change, leadership is crucial. It's easy to think of who the leaders are when you're talking about change in your organization, right? It's my boss, it's me, it's some of the managers who work for me. It's a lot harder to think about leadership when you're talking about multiple organizations. But the fact of the matter is, leadership is critical. It's important for leadership within each organization participating in a collaborative to be bought in and believers in what the collaborative is working on. Otherwise, the work and the change gets ignored. It's also really important within the cross-sector group for folks to be willing to play a leadership role. That doesn't mean that everybody has to want to be the chair or a co-chair of a group. It means in this context, leadership is being willing to step up, be vulnerable, and think of the greater good. Speak out for the change, demonstrate leadership for change in a cross-sector setting. Don't just bring your mindset of, I'm here to watch out for my organization. When one person in a group makes a comment like that, that's selfless, or says, hey, you know what, my organization, you know, this is kind of hard for us because of X, Y, or Z, but I can see that for what we're trying to do, it's really important that we be a willing partner, therefore we're going to step up and do it. That really changes the dynamic and makes a tremendous difference and really creates a safe space for everybody in the collaborative to step up and do the same and play a leadership role in working together in a meaningful way. The Public Health Foundation developed a document that I think is really helpful and we can share as a resource. It may already be on the website, Cherise, from the first iteration of that training, but they created a matrix for potential cross-sector collaborative members to use to prepare for a change initiative. More and more there is recognition that the work we are all trying to do can't be done in one sector alone. You know, healthcare has come to the recognition that social determinants have a huge impact on health outcomes and healthcare costs and healthcare needs. The social service sector recognizes that health needs are a huge driver of needs for social resources. The criminal justice system is intertwined in all this, the economic system. So, you know, all of these things are interconnected. More and more foundations and think tanks are spending time thinking about what makes cross-sector collaboratives successful or not. And so hence the Public Health Foundation developed this matrix. But so it provides a structure for members to talk about what they have in common, their differences, any barriers that are going to hold them back from collaborating, and what it will take in order for them to collaborate. And after going through this process, the collaboratives should then be ready to determine the focus area for change, what the cross-sector initiative is going to be. It's a very simple matrix. So, you know, my recommendation would be for any kind of cross-sector group, and, you know, you could even really use this within your own organization if you've got different departments that really work in silos. You know, I think it could be a useful tool for that as well. But you start by determining, okay, what do we have in common? What do we all want, or what do we all do that's the same, or who are we all serving that's the same population, all your commonalities. Then just identify all your differences. Well, we all serve the same population, but I, you know, only work on housing and you only work on food. And then after you identify what you got in common and what's different, you start to dig in on the barriers. What gets in the way of collaboration? Is it that you've got different funding streams and there are really rigid rules around how you can use those funds, even though you wish you could use them for something that would help your partner? Just lay those all out. And once you've gone through the first 3 steps, you then ought to be able to identify, okay, what are some potential areas for collaboration and where do we want to start? It's not rocket science, pretty simple and straightforward, but usually when it's simple and straightforward, it's more effective than when it feels like rocket science. So I really like this matrix and think it's very helpful as a way to kickstart collaboration. So here is an example of a readiness matrix for a cross-sector collaboration between a public health agency and some other human service organizations around a table. You can see what they identified as commonalities, as differences, as barriers, some of which they have control over, some of which they don't, and then the areas they identify for collaboration. Okay. So lastly, I want to talk about what makes change efforts fail and what helps them succeed. As I have said multiple times, change is really hard. The effort needed to implement change really has to be appreciated. If you discount that, your change is more likely to fail. Even if you've got a group of 100 people around a table and every single one of them says, yes, this change makes sense to me, I believe in it, I want to do it, it doesn't mean you're guaranteed to succeed because change is hard. Research shows as many as 75% of change initiatives fail. Reasons for this are the vision isn't clear or isn't clearly communicated. There's a lack of leadership or just minimal engagement of leadership. Leadership matters a lot. The words our leaders say matter a lot, matter more than we even kind of think they should, but they really do. They set the tone, they set the priorities, they send a message about where it's important to focus and where it isn't. So having leadership buy-in for your change is really critical to being effective at implementing the change. One example of this I have when we were shifting from our old model of managed care organizations to standing up the coordinated care organizations here in Oregon, which was going to be a fundamental shift in how business was done for the state agency, as well as plans and providers out across the state. One of the best things our governor at the time did, Governor Kitzhaber, was we held a meeting for staff in the Medicaid agency, and the governor came to it. And it really was just for agency staff, nobody else, no outsiders, no reporters, no legislators. And he came and made his pitch, a very emotional pitch for why he believes in this model, what he thinks this model will accomplish, and what he was asking of the state employees in order for this to be a success. That one step made a significant difference. And you know, as many of you know, change can be particularly hard in large bureaucracies because the people who work there for a long time learn again and again. The more you stick your head out and try to do things differently, the more likely you are to get bashed over the head, right? So it was incredibly important for the governor to take the time and not underestimate the importance of communicating a vision and having it come directly from him, not from, you know, 3 or 4 people down the line that he told to go say it. Not establishing a great enough sense of urgency is another reason why change initiatives can fail. If I believe in the change, but you know, it's as good if I do it 10 years from now as now, and I got a lot on my plate right now, I don't have the urgency to implement the change, and that undermines the effort. As I mentioned earlier, dismissing concerns, not allowing for honest dialogue, not understanding different factions, either barriers or motivating factors for change will all get in the way. You really have to think of change management as your internal politics, and it needs as much lobbying and relationship building as any policy that somebody wants to go get, or bill somebody wants to go get passed in the legislature. You're just, instead of a group of legislators, you're talking to your colleagues or your staff or other teams within the organization. Not having a measurement plan. Got to have a measurement plan, otherwise you don't know if your change is working and you don't have quick wins to celebrate. Not having short-term wins, and declaring victory too soon. Those are all the reasons why so many change initiatives fail. You might be asking yourself, okay, that's what not to do, but what should we do? So one, do not forget the fact that change is about working with people and the human side of policies and processes. I love this little cartoon. Who wants change? Everybody raises their hand. Who wants to change? Nothing. So don't focus just on the project management side, the policies, the technology, what new shiny technology system you want to implement, without focusing on the people who are going to use that system. And then leadership and communication are at the absolute top of the to-do list for being successful in your change. You got to communicate. Leaders who are unsuccessful focus on the what behind a change. We just bought this system and we're going to implement it. Successful leaders communicate the why in addition to the what. We just bought this system, we're going to implement it, and here's why. It's going to make life better for workers who have been complaining about how long it takes to process an application. It's going to make life better for clients who have serious needs and end up waiting too long for resources to be connected to them, so on and so forth. Collaboration. Successful leaders work across boundaries. They encourage their employees to break out of silos and don't tolerate unhealthy competition. You want to build an organization where people are working together like a finely tuned machine and feel empowered to be part of the change process. This means including employees early on in some of the decision making, because it helps to strengthen their commitment to change and also gives you important information you need for your change to be successful. And lastly, commitment. Successful leaders have to make sure their own beliefs and behavior support the change too. They devote more of their time to the change effort and are focused on the big picture. Unsuccessful leaders don't do this. They're negative, they're impatient with a lack of results, and they don't adapt to the challenges or the lessons learned along the way. So that is our quick 101 of all things change management. I would be happy to answer any questions that you all have.
Hey, Kathy, while folks are thinking about what they'd like to ask, would you mind sharing? I think it's always nice to hear not only a success story, but also maybe an experience that maybe went a little awry and how you
Sure.
perhaps fix that. That would be great. Thank you.
There's nothing I would love more than to share an example of a time I did a bad job, Cherise. Thanks for asking.
I can certainly share.
I've got plenty. No, I've got plenty. So I've got a story that I really like to tell because I think it's a good illustration of the importance of communication. So when I was first hired by the state to go in and stand up the Healthy Kids program, expanded health coverage for kids, it was a big shift. It's like 2009, and the agency for a long time had sort of been in a place of keeping people out. So more likely to deem somebody not eligible for health coverage, even if they might be eligible, making it harder, putting up barriers. More important to make sure not a single person who isn't eligible gets in, even if it means 100 people who were eligible are also kept out at the same time as a result, right? So a big cultural shift to move into Healthy Kids, be getting ready for the ACA expansion of Medicaid, to say, we want to make sure people are eligible. We don't want to enroll someone who isn't eligible, but we want to stop making the process cumbersome unnecessarily, because it's undermining where we're trying to get to. So stood up the Healthy Kids program, developed a bunch of really beautiful marketing materials and all kinds of languages for all kinds of communities, developed partnerships with hundreds of organizations across the state so they could provide on the ground application assistance and outreach, just walking around feeling really good about myself and what I waltzed into this big state agency and done, only to find out on day one of opening enrollment for Healthy Kids that families were showing up at the state eligibility offices all across the state and being told by the eligibility workers that they had no idea what Healthy Kids was. So I had made a fundamental misstep and had a good lesson learned of the importance of communication, not just externally, but within the organization, the importance of actually talking to the people who will do the work. So with hat in hand, I had to go back to square one and do what I should have done in the first place and start to engage in conversations with eligibility staff, make sure they understood the program, make sure they understood what my team was doing, but also make sure that I understood what their jobs were like, what things they saw as barriers, their ideas for improvement. And once I did that, we managed to create a system that worked incredibly well and never could have done it without actually working with and engaging the frontline staff.
Thanks so much, Kathy. I really appreciate your ability and willingness to be transparent too, because I think that's really the critical piece. And we have a couple of chat questions. So Annabelle from Ponderay, she states, ideas, strategies, managing change fatigue that may look like resistance when there are multiple changes needed or required in a short period of time, as well as ongoing change initiatives. And here's a quote, seems like every week there's a new change. So very valid, Annabelle, thank you.
Yeah, so awesome question. And definitely a legitimate experience for many people, especially in larger organizations. So I would say, I think I'm hearing two things. One, change fatigue is real. And if change fatigue is happening, it's happening because either the processes haven't been set up to allow for quick wins or lessons learned, so people can continue to feel bought in and re-energized because you finally crossed a hurdle. You're not just on the gerbil wheel spinning and spinning and spinning and not seeing any result for it. So that would be one piece. And then two, I think there, more often than not, typically is an underlying leadership piece, because in order to be successful with your changes, you've got to pace it right. And it's a balance of, you want urgency. You actually want it. It's my experience is that you're more successful with change if there is a little bit of a feeling of drinking from a fire hose and the time is now and there's no time to waste, right? Urgency really helps. On the other hand, you can't ignore capacity and the reality of how hard implementing change can be. So you need leadership and a change management leadership team that recognizes both those things. And it's a little more art than science, but you want to maintain urgency and keep pushing for it. But you also really want to have open ears and open dialogue with staff so that staff don't feel helpless and don't go into that phase of change fatigue, where once you're in change fatigue, you're starting to lose desire and buy-in, and that means anything you're trying to accomplish will be dead in the water.
Thanks so much, Cathy. I think that was terrific, and certainly something that I know a lot of our organizations are feeling. So I think that great question, Annabelle. Thank you for asking it. And then we have one more from Jennifer at Aging and Long-Term Care. She asks, how do you lead a change when it will be positive for some staff and negative for others? And the negative, they may, potentially lose their jobs. How do we communicate and get behind the change when we know that it will not be good for some?
Yeah, that's always really difficult. Nobody wants to lose their job. Nobody wants to do something that's going to make a colleague lose their job. So that, I just want to acknowledge that nothing makes that easy, but sometimes it is right and necessary. And so I think obviously you need to make sure your HR department is a part of the change management team and can provide guidance and advice all along the way. You don't want HR to not be involved when part of the change you're talking about is going to be that big an impact on the agency and potential job loss for employees. So HR needs to be involved. And then, I think the only way to navigate that challenge is with HR's guidance to be upfront and clear that this is what's being planned, to acknowledge that it may impact people and that that's not done lightly and without a lot of thought and consideration, and to make an honest commitment to make sure that the employees who may lose their jobs or be otherwise negatively impacted are going to be cared for. We're going to do our best to move them into different jobs. We are going to provide all kinds of resources to help them find other jobs. We will manage as much of this as possible through attrition, whatever steps you can take. I think it's delivering bad news is only made worse when people aren't clear about it and honest. And I think the only way to really navigate what is a really challenging situation is to be open, to be honest, and to genuinely care and express caring about the people who might lose their jobs, and to do the right thing, which is whatever you possibly can do to make that transition easier rather than harder.
Great question, Jennifer, and I'm sure that's one that all of our organizations unfortunately struggle with at some point. So thank you. Cathy, thanks so much. Always, I love your trainings, and always, even though this was my second time through, I learned more and have notes. So really appreciate it.
That's great, Shrees, because my jokes never change. So.
So next Thursday, August the 6th, we're going to continue with Cathy in part 2 of our series. And that one will take a deeper dive around the strategies for working across organizations and sectors, which is what a number of you folks are doing. So I know I'm looking forward to it. We'd love to have all of you back for that. But thanks so much for joining us. Hope you have a wonderful afternoon. And please
don't leave quite yet. We have a quick feedback survey, if you don't mind. Just helps us to know for future trainings. So
great. Thanks, Sarah.
Thanks, everybody. Always fun to talk to you all. Enjoy the sunshine.